Welcome to Sketchy. We take all the super complex stuff you need to learn and turn them into memorable visual stories packed full of everything you need to know on test day. Click the link in the corner or description to try for free for 7 days. Now let's get to it.
Time to discuss the vasculitis. Vasculitises?
It's vasculitides.
What? Disease? No, it's definitely not that.
You're so embarrassing yourself right now.
I'm embarrassing myself? You're embarrassing do you even hear yourself right now?
And now you're raising your voice?
I'm raising my voice, or you're raising your voice. All right. Time to discuss vasculitis. As the name implies, vasculitis is inflammation of blood vessels. And the clinical signs and symptoms can vary depending on the size of the blood vessel. In this scene, we're going to focus on large and medium vessel vasculitis and save the small vessel vasculitides for our next video. So, because we're focusing on big vessels, we're headed to the big city. And this is an itis after all. So we're going to be turning up the heat. Most vasculitides are thought to be immune-mediated. So we've sketched in a few immunoglobulins on the sign in the top of the scene. The exact etiology, however, is generally only known in a very small minority of cases. What we do know is that most cases are either antibody-mediated, a type 2 hypersensitivity reaction, in other words, or immune complex-mediated, which is a type 3 hypersensitivity. Additionally, for giant cell arteritis and Takayasu, the underlying mechanism likely involves a cell-mediated type 4 reaction preceded by granuloma formation. In addition to hypersensitivity reactions, vasculitis can also be caused by direct external damage to blood vessels, as is the case with radiation, toxins, and mechanical trauma. For our next 2 videos, however, we'll be focusing on immune-mediated systemic inflammatory conditions. So expect the usual systemic inflammatory symptoms. That means fever, arthralgias, and weight loss in some cases. As illustrated by Braden over here, who started this whole debacle while live streaming for his YouTube channel. Will it burn? Yes. Yes, it will, Braden. Now go get a real job. Because of the inflammatory nature of vasculitis, serum markers such as ESR and CRP are often elevated. These markers are called acute phase reactants and are known to increase in serum concentration in times of inflammation or tissue injury. And don't be fooled by the name. Acute phase reactants can be present in both acute and chronic inflammatory states. ESR stands for erythrocyte sedimentation rate, an indirect marker for the presence of acute phase reactants in general. ESR simply means plasma viscosity. Lots of acute phase reactants in the blood, including fibrinogen, means increased viscosity and an elevated ESR. In this scene, ESR is embodied by the wind chime, with those cylindrical chimes evoking an image of plasma settling when placed in a vertical tube, the old-school way ESR is measured. CRP stands for C-reactive protein, an acute phase reactant thought to have both pro- and anti-inflammatory properties. At Sketchy, whenever we mention CRP, we'll bring back the CRP carpet. Now, don't get too caught up on ESR and CRP, as they're increased in a whole range of conditions, usually because of infection. Just remember that if you spot one of these values in a question stem, the question writer is probably trying to clue you into some kind of systemic inflammatory disorder. When diagnosing vasculitis, focus instead on patient history, physical exam, and a few specific lab and microscopy findings, which we'll outline shortly. All right, let's start our discussion of large vessel vasculitis. There are 2 forms of large vessel vasculitis: giant cell arteritis and Takayasu arteritis. We'll begin with the giant cell, the most common form of vasculitis in adults. Giant cell arteritis affects large and medium-sized blood vessels, with a weird and oddly specific predilection for the cranial branches of the carotid artery. By that I mean all those arteries supplying the head, especially the temporal artery, which is why giant cell arteritis is often called temporal arteritis. So on our next citizen in need of rescue, we've drawn in an arterial glasses strap, headed upwards to each temporal region. Surrounding vessels are commonly affected as well, including vertebral and ophthalmic arteries. as well as the aorta itself. So we've added an aptly placed plant out on our balcony, outlining the major branches of the aorta coming off the arch, as well as the internal and external carotid branches up next to her neck. Lesions in these branches are going to give us some of the classic symptoms of giant cell arteritis, which we'll outline shortly.